New at noon, we are hearing that some Oregon doctors can't even get the vaccine for themselves. Fox 12's Marilyn Deutsch has the story.
Oregon's large hospitals and health systems have started vaccinating their healthcare workers. But doctors in private practice, not affiliated with these larger institutions, have not been able so far to get the vaccine themselves.
3, 2, 1, go.
Over the last few weeks, we've seen real hope as our frontline workers and first responders get their COVID-19 vaccines. But doctors in private practice have not been so fortunate. Dr. Maureen Mays runs preventive primary care in Northwest Portland.
I've had multiple patients with COVID-19. I've been doing testing here at my office since March, but I had a case in early April. I have 2 active people now, and I see patients all day, every day in my private practice.
The problem is, says Dr. Mays, only those healthcare workers associated with the big institutions have been able to get the vaccine.
Physicians are supposed to be in the top tier, and I'm in no way saying that I should be up with the emergency physicians or ICU doctors, but physicians are definitely in the top tier above people that don't have patient contact for sure.
And while we have seen the video of ER docs and ICU nurses and first responders getting the COVID-19 vaccine, others who work with the local hospitals are also getting the vaccine. And Dr. May says that's a problem.
When you put the vaccine in the hands of people who have a financial stake in giving it to their own employees first, I don't think that that's necessarily the way to go. So, for example, people who work in billing and coding at large institutions have had the vaccine, and they have no patient contact. In fact, most of them are working from home.
Dr. Mays also thinks the rollout could have been smoother and more efficient if the hospitals had not handled the vaccines in the first place. She says they've got enough to do. She thinks the state should have called in the National Guard.
They're made to be able to mobilize quickly and set up in the field.
Dr. Mays also tells us her patients keep asking her if she will be able to give them the COVID-19 vaccine. And she tells them honestly, she doesn't know. In North Portland, Marilyn Deutsch, Fox 12 Oregon.